EKG burst, part 3. Diffuse mild ST elevation in an asymptomatic patient could represent this abnormality. Diffuse mild ST elevation, asymptomatic patient. This could represent an early repolarization abnormality. Now, what if that patient has chest pain and a friction rub on exam? Then you should be thinking about acute pericarditis. You'd have the patient lean forward, and hopefully that would help alleviate the pain. Small Q waves, i.e. non-pathological Q waves, are common in most leads except the following. Small Q waves should never be seen in AVR, B1, B2, or B3. And small Q waves should be less than what duration? Less than 0.03 seconds. What are the criteria in diagnosing Q wave MI? Q wave MI is diagnosed only if Q wave changes are seen in at least 2 contiguous leads, and if the depth of the Q wave is greater than what? A Q wave depth greater than 1 millimeter. So Q wave MI, number 1, Q wave changes in at least 2 contiguous leads, and number 2, a Q wave depth greater than 1 millimeter. A bifid P wave in lead 2 that is less than 0.03 seconds may represent this condition. Bifid P wave in lead 2 less than 0.03 seconds is nothing. This is a normal phenomenon. QRS voltage greater than 12 in lead AVL meets criteria for which type of hypertrophy? QRS voltage greater than 12 in lead AVL. Left ventricular hypertrophy. This is just one of several criteria that can be used to help diagnose LVH. A QRS greater than 12 millimeters in AVL may signify left ventricular hypertrophy. The second most common cause of unexpected sudden death in young patients is what? Arrhythmogenic right ventricular cardiomyopathy. These patients often require ICDs, and we'll go over the indications at a later time. But for now, you should know the seriousness of arrhythmogenic right ventricular cardiomyopathy. And the leading cause of sudden death in young patients is what? Hypertrophic cardiomyopathy, right. What is the formula for corrected QT interval? The formula for corrected QT interval is defined as, it's a formula, and it's really difficult to talk about formulas on an audio presentation, but it is the QT interval in seconds divided by the square root of the preceding RR interval in seconds. A second method, the one I actually use, is to know what the normal QT is for a given heart rate, and then compare my patient's QT to normal. Okay then, so what is normal? For a heart rate of 70, the QT interval should be 0.4 seconds plus or minus 0.04 seconds. So really anywhere from 0.36 seconds to 0.44 seconds. Then, for every 10 beats per minute above that, subtract 0.02 seconds. For every 10 beats below 70, add 0.02 seconds. So, if the heart rate is 70, you would expect the patient to have a QT of 0.4 plus or minus 0.04 seconds. So that you have to memorize. A patient with a heart rate of 80 should have a QT of 0.38 plus or minus 0.04 seconds. A patient with a heart rate of 90 should have a QT of 0.36 plus or minus 0.04 seconds. A heart rate of 100, 0.34 seconds. Heart rate of 110, 0.32 seconds. Heart rate of 120, 0.30 seconds, and so on and so forth. A heart rate of 70 should have a QT of, once again, 0.4 seconds plus or minus 0.04 seconds. A heart rate of 60, 0.42 plus or minus 0.04 seconds. A heart rate of 50, 0.44 seconds. Heart rate of 40, 0.46 seconds, and so on and so forth. Example, If you measure a QT interval of 0.4 seconds on your patient that has a heart rate of 120, would this be normal? If the heart rate is 120, you would expect the QT interval to be 0.3 seconds plus or minus 0.04 seconds, so anywhere between 0.26 and 0.34 seconds. This patient thus has a prolonged QT because 0.4 seconds is outside this range.